A 6-year-old child has suffered a displaced supracondylar humeral fracture. On examination, he has a cold and intense insensate hand with absent pulse. What is the most likely underlying cause? That means a 6-year-old child displaced supracondylar humeral fracture, and on examination the hand is cold and insensate with absent pulse. So what is the cause? That means the vessel is compromised. So what may be the cause? Here the options are clot embolus, compartment syndrome, Steele syndrome, direct arterial injury, and vasospasm. So let's see, both vasospasm and arterial injury may complicate the supracondylar fracture. That means in case of the supracondylar fracture, vasospasm may be a cause of absent distal pulse, and direct arterial injury is another cause to complicate or to absent pulse in the distal region. But the vasospasm, usually the vasospasm is transient. That means for a time being, for a short period of time, and injury is very minor. That means there is, in this injury there is displaced fracture. That means the huge injury. So vasospasm occurs only in the minor injury, and it reduced early. That means it recover spontaneously within very short time. On the other hand, when there is the arterial injury, it occurs in case of the severe displaced injuries, and there is more advanced sign and also associated with direct injury. Now see the direct injury of the artery. So here we can see this is the brachial artery, which supplies blood to the upper limb or in the arm, forearm and hand, and here we can see there is the displaced fracture of the supracondylar fracture of the humerus, and here the brachial artery, it entrapped between the fracture segment. Here we can see this artery is entrapment within this fracture segment. Here another option also, here we can see the brachial artery, it greatly injured by this fracture segment. Also the compartment syndrome, this is another complication, may develop from any type of the fracture, and in this condition 5P is important, which is the pain, pallor, paresthesia, paralysis and pulselessness. And this pulselessness is the most late feature. So in case of compartment syndrome, all the 5P should be present. That means the pain, pallor, paresthesia, paralysis and pulselessness. But in this question only pulselessness, other options are usually absent. So absent pulse, displaced supracondylar fracture, it occurs due to the direct arterial injury. Vasospasm is another option, but vasospasm, it occurs only when it occurs only very shorter period of time, and there is the less injury. Steele syndrome, it occurs in the head area, and the compartment syndrome, in case of compartment syndrome there 5P should be present, but here there is no 5P. That means the pain, pallor, paresthesia, paralysis and pulselessness. And clot embolus, it is not possible to develop within short time the clot. So our answer is the direct arterial injury.